All right. Well, it looks like it's 12 o'clock. We'll go ahead and get started here this afternoon. Thank you, everyone, for joining us. Looking forward to this presentation from our friends at ECBM and Roundstone. Here to talk about some high-quality healthcare benefits that are available for your employees. My name is Brandon Marie. I'm the Director of Member Communications for the Pennsylvania Motor Truck Association. There is a Q&A box and a chat box at the bottom of your screen. If you have any questions as we go along, feel free to punch those in there, and we'll get to those at the end. I'm going to go ahead and turn things over to the team at ECBM and Charlie Bernier.
Good morning. Thanks, Brandon. Thanks, everyone, for joining. It's the first one we've done. I appreciate the time, so thanks. We'll keep it on point. Background. ECBM and myself have been involved with PMTA for 34 years, maybe 40 years. All different capacities of support, and also on the board as a board member and a state board member. One of our missions has been historically going back even to Jim Runk and I talking about how to come up with a program that could help the PMTA members and the health insurance. And the hurdle has always been that we were unable to find anything that could cover the whole state and match the plan that each individual trucking company had. And the second thing was that it could go down to the smallest number of members. That was always a challenge. And in last year, working with Roundstone, they have developed a plan that really came out of the Affordable Care Act, and the fact that they're now able to come up to bring, as you see the tagline, Fortune 500 company type plans to all size employers, which means that you're able to opt out of the normal plans that are based on where you're located and what the geographic area is, which is normally the community plan. So because of that, they are able to look at each truck line. Not everybody will qualify, but if they look at your actual information and then tie it into the data that they've developed and have access to now, they can normally give you a plan that is more cost effective, gives you the ability to bend the growth line in cost this year and then going forward, and also do the whole state. So these are the main things that we looked at, and this Roundstone has solved those major hurdles. So with that, I'll turn it over to Jack. Jack is from Roundstone and will explain the program.
Thank you, Charlie, and the ECBM team. Thanks, PMTA, for having me here. And I have a couple slides that I want to go over that walks through Roundstone's program and how it helps small and mid-market employers manage and provide quality benefits, just like they're a Fortune 500 company. First, I'm going to identify the problem that we see with healthcare today, specifically health insurance and the rising cost of it. And then I'm going to switch to how these large Fortune 500 companies in the United States, how they've attacked the health insurance problem and what they've been doing over the last 10, 20, even 30 years to control their costs over the long term. And then lastly, we're going to talk about how you, as a PMTA member, a small mid-market employer in Pennsylvania, how you can use some of those same strategies that these larger corporations in the United States use, how you can use those to better manage your healthcare spend, but also at the same time provide quality benefits to your employees. The tagline here is how you guys can form a plan like a Fortune 500 company. So let's get into it. So what's the problem? Well, over the last 10 years, this is really all across the United States, and Pennsylvania is starting to see these cost increases. But your traditional health insurance plan, it's not abnormal to see a double-digit increase in your health insurance premium. And the reality today for a lot of small and mid-market employers, anywhere from 20 to 500 enrolled employees on your health plan, is that a lot of groups, their health benefits are a top 3 line item expense at their company behind payroll and maybe something else. Your current costs, if you continue to get double-digit increases, your current costs will be doubled in 4 years. So if you spend $500,000 in healthcare today, in 4 years, your healthcare spend will be $1 million. And then the other reality for small and mid-market employers is that you have no reporting. The insurance carrier doesn't share anything that you're spending your money on. And I would challenge a lot of maybe CFOs or HR managers who are on this presentation, what other cost in your business do you have zero reporting, or, you have no idea what you're spending your money on? And it's important if you're trying to fix a cost, you first have to understand the problem and what is happening on your health plan that is causing your rates to double or to increase by 10 to 20% year after year. So what do the Fortune 500 companies in the US do? Well, first, they start by self-funding their health benefits. Okay. 90% of employers with more than 1,000 employees on their plan self-fund their health benefits plan. They do this because it opens up three things for them. The first is transparency. So now you as a self-funded employer get access to 100% of the claims detail. Now you can't customize it to see as much or as little as the claims detail you want, but the bottom line is you can track where every penny that you spend on healthcare, where it goes and why. And that's the first thing. The second part is that you now have control over your health benefits. You can design a plan that best fits your employees, all right, and where they're going and what their health needs are. And then you can also, implement different cost containment strategies that make sense for your population based on what the claims data is telling you. You guys as the employer know your employees better than any insurance company out there, right? So it proves to be very valuable when the employer can say, hey, I don't think our employees really like this very high emergency room copay. Maybe we should lower that. And in a self-funded health plan, you do have that ability to customize those benefit designs however you see fit. Then lastly, the third thing that it allows these larger companies is it is a truly keep what you don't spend type of plan. On average, about 80 to 85% of your cost in a self-funded plan is variable. Meaning if you spend $1 in health insurance and you don't spend, there's no claims to be incurred, your employees didn't go to the doctor or hospital or anything, you can retain or keep 80 to 85 cents of that dollar. All right. And that is the key to keeping those costs flat, keeping the profit out of the insurance carrier's pocket and keeping them with you in your operating account right at your business. You can use those savings really however you see fit. Most likely, employers will just reinvest it back into their health plan or for their employees. And Fortune 500 companies have gotten very good at doing this over the past 20, 30 years. They've managed their health insurance costs to inflation levels. They use best-in-class provider networks that work all over the country, all over different states. And they implement different types of programs that could really benefit your employees. A popular one today is like a diabetic management program. If you have people with diabetes on your health plan, providing coaching, also a way for the employees or members on your health plan to get the supplies and insulin at a cheaper price can prove very valuable. One, it helps reduce claims costs in the future, right? But it also helps with retention, and so that your employees really feel like they're being taken care of. You're providing all these different avenues that they can seek better care. And that's just one example of many. I can talk for probably 12 hours about different things our clients have done across the country to better manage the cost, but also provide a better quality benefit. So the next logical question that I'm sure some of you have is, well, how do I, as a 50 life company, or 25 life company, or maybe even a 300 life company, how do I benefit? How do I get access to all of those same things that a large Fortune 500 company gets? And the answer to that is you kind of band together with employers your size, and you start by, one, group purchasing the insurance you need to protect against catastrophic losses. You group purchase other vendor services that you need to properly run a health plan. All right. And then you take that group purchasing arrangement, and now instead of a 50 life company, you now are band together in a pool with maybe 300 other employers or 70,000 lives. And now all of a sudden you become a large Fortune 500 company when you're insuring your benefits. And by doing that, you then get access to things like your plan costs, and you can review those with your the ECBM with Roundstone has data analytics folks, and you can make decisions on better, providing better quality benefits to your employees, however that may seem. It's not a one size fits all, right? So, one company has different needs than another company in terms of what their employees are looking at, if it's diabetic management or maybe it's pharmacy related. There's a bunch of different things you can do, but there's not a silver bullet that I can give you today. Say, hey, you got to do this. The first step is getting access to the claims data and find out what's going on in your health plan. All right. Now, how Roundstone is banding these small mid-market employers together is through what is called a group medical captive. Captives have been around a long time. Some of you may be familiar with them on the property and casualty side of insurances, but they are also available on the health insurance. And a captive, the bare bones of it, what it is, it's a health insurance pool formed by companies that want to band together to reduce the cost of their health insurance. Now, a group captive is very similar, right, than what the Fortune 500 companies do, what their type of plan is. Approximately 15 to 20% of the cost is fixed. 80 to 85% of it is variable. So what that means is if we do a good job providing better quality benefits and helping reduce costs for your employees, you as the employer retains those savings, 80 to 85% of your dollar you keep. That's a pretty stark contrast to your traditional health insurance options out there, what we call fully insured health insurance, which is 100% fixed cost, meaning you write a check each month, you kiss that money goodbye. It doesn't matter what your claims were. If it's less than your premium, then it's just profit for the insurance carrier. There's no transparency, and there's certainly no control in that type of environment as well, which makes it very difficult to manage a rising cost on your balance sheet. So what is the average captive employer? What does our average client look like today across the country? Well, they come to us with two thoughts, really. The first is, I don't have any transparency to my claims. I don't know what I'm spending my money on. And if I'm trying to fix this cost, the first thing I need to do is get access to that claims data, figure out what's going on. Secondly, it's a cost that is becoming a problem. Some CFOs are noticing that the health insurance is just rising up that balance sheet year after year, and it's getting to an untenable point for the employees as well, because your employees are also taking the burden of those cost increases. Our average client has about 85 employees on the health plan, and I'd say the biggest one, the biggest thing that a lot of our clients have in common is the CEO, CFOs, HR managers are engaged with the employees and the health plan and trying to find a better way to manage their health benefits. This is certainly a collaborative effort. And the ones that have the most success truly want to provide those good quality health benefits to their employees, and are willing to collaborate with Roundstone and ECBM to get us there. What does Roundstone look like? What does the pool of employers look like today that's banding together? Well, nationwide, it's about 500 plus employers, over 100,000 lives covered. So you can think of it like a pretty large company that you're banding together with already. We cover about $1 billion in healthcare spend today. And we are in 40 of the 50 states, and Pennsylvania is one of our larger markets. And a lot of companies in Pennsylvania have had some success with this group medical captive model for their health insurance. Why is self-funding the trend, and specifically why is self-funding the trend with small and mid-market employers? Well, we already talked about costs are rising in healthcare exponentially. Family coverage, so the cost for insurance premiums for a family has risen by 22% over the last 5 years. So family wages versus health insurance premium, families are actually making less money today than they did 5 years ago because of the cost of health insurance. There is the portion that the healthcare system, there's a lot of waste that goes into the healthcare system, a lot of profit for different entities that you might not even be aware that they're there. The Kaiser Family Foundation estimated there's $935 billion of healthcare spend waste today. And that takes up about 7% of the average working income in the United States. So, you can bookmark 7% of your take-home wages going to healthcare a year. And we don't see that cost stopping. So Roundstone, we're trying to buck that trend. We're trying to help these small mid-market employers keep those costs flat over the long term. Just in the past 12 months, we've returned $20 million to our clients of unspent claims funds, of unspent premium dollars we sent back to our clients is about $20 million. And groups that have been with us over a 5-year period have saved 20% compared to what the traditional health insurance options are out there. And that kind of is backed by our Roundstone Guarantee. Roundstone, we came out with our guarantee the early part of this year. And we said that we guarantee you will save money in a group captive self-funded solution as opposed to what you're doing now. And if you don't, after 4 years, if you haven't saved money, we'll make up the difference. That's how confident we are in our solution. Roundstone, we're in our own solution. We practice what we preach. We have about 100 employees, probably about 60 or 70 on the health plan. And we've been in it for 8 years, and our costs are the same today as they were 8 years ago. And that's our goal with every single one of our clients. You can look back after 5 years and see that your cost is close to, if not the same as what you were paying 5 years ago. And if you haven't saved money with us, then we'll make up the difference. We'll send you a check for your claims fund. And with that, I will take any questions. I kept it very high level. So if there's any questions that you guys have more detailed, you can either ask it now, or we can set up like maybe a one-on-one discussion to really get into the weeds and nuts and bolts of how the program works.
Jack,
and actually, I'll pause.
Go ahead.
I was going to say, Charlie, if you have anything to add.
I was just going to say bring up the fact that they can stay with Cigna or United. The healthcare card will say Cigna, United, I guess, or Aetna, one of the three. So your employees will see the same card that supposedly they have now. So that's always great when the point of purpose when they go to the doctors and in hospitals. There's not like a third thing that they have to go through. So the ease of use of this is really great for your employees.
Yeah, your employees generally don't notice a difference. They have your traditional health insurance card with the Cigna or Aetna logo on it. For them, they have their normal co-pays or deductibles that you're either keeping or, maybe if you want to make stronger. They certainly will notice, though, if you have more programs to help them live healthier lives, right? That's definitely a plus, I think, for a lot of employees.
Jack, this is Brian. Just a quick question. As far as like a setup process goes, if I was interested in, you know, exploring next steps or potentially moving on to Roundstone, like what would that process look like?
So we would need just some traditional data that you would need to get a health insurance quote today, you know, a census, plan design, stuff like that. And our underwriters at Roundstone would analyze your spend and what it would be in a group medical captive that we operate. And the first step is to see, hey, you know, is this a good fit for you financially? Does it make sense? And then secondly, there's the, you know, education of, you know, how the pieces and parts work, and kind of set up a roadmap as to how we're going to go about attacking these costs over the long term. And so, you know, takes, I would say maybe 4 to 5 months before your effective date, you start that process of us making sure it fits financially. So 4 to 5 months before your effective date. I see there's a question here. Can my employees keep you a PMC? And the answer is yes. The Cigna network and Aetna network give access to both the UPMC facilities as well as the Allegheny Health Network, so Highmark facilities as well. So they get same access to doctors and hospitals that they're normally accustomed to. That's a good question.
Yeah.
See here, I don't know if there are any other questions. Maybe wait another couple minutes. If you guys do want to deep dive this further, you can reach out to ECBM to kind of start exploring this further. Brian or Charlie, maybe, do you guys have a contact information that they can reach out to if they're interested in learning more?
Yeah, I reached out to John Barrett.
Yeah, I'll make sure to send a follow-up email to everyone on here with a landing page, just brief information, name, company name, email, and size, and then we'll follow through with that and get a census from everyone.
So the overall goal, just so everybody knows, is to grow this within the PMTA, so that eventually PMTA can use this as a door opener to bring more and more people into the PMTA association, which helps everyone. So that's a big part of what we're doing this for.
I'll just add that for those of you that have member logins for our website, the member benefits page on pmta.org, it's got some things listed there, and there's a link to the landing page. The button says PMTA Group Captive Healthcare Plan. If you click on that, it'll take you to a landing page where you can fill out that a little bit of information, and someone will get in contact with you.
That's good. Yeah, I think we should probably do more of these in the future. I know there's a lot of questions. So thank you all.
Thank you.
All right. Well, thank you. We will be following up with some emails, but thank everyone for spending a little time with us this afternoon, and I hope you have a great rest of your day.
Take care. Enjoy the summer.
Thank you.